You're watching the award-winning GHS-TV, a nationally recognized student television station.
Hello and welcome to Medical Talk. I'm your host, Betty LaMarr. Medical Talk is all about giving you the tools you need to make healthy lifestyle choices. On today's show, we're talking about the health risk associated with overweight and obesity. And here to talk to me today is Dr. Robert Wegner, bariatric surgeon and medical director at the St. Francis Center for Surgical Weight Loss. Hello, Dr. Wegner, and welcome to Medical Talk.
Hi, Betty. Thank you for having me back. Appreciate it.
I appreciate you too. You know, in the Mid-South and in the United States, you know, we pretty much have an epidemic of overweight and obesity. So, first of all, we're going to jump in. What is a bariatric surgeon?
So, if you just talk about bariatrics in general, just break down the word bari, it means, you know, pressure, Greek for pressure. And bariatric is, you know, a surgeon who basically treats the high pressure of the body, so to speak. Bariatric surgery has to do with, you know, creating a surgical procedure that makes the patient, you know, lose weight essentially through the surgery. The specialty has evolved over the past, you know, 2 or 3 decades to being very specific to treating patients with a certain BMI, which, as we, you know, have talked about before, is, you know, body mass index.
Yes.
And that's how we talk about obesity and overweight and morbid obesity kind of in numerical terms. But, you know, what I do is very specific. And what you mentioned about obesity being an epidemic, that is the word. It is an epidemic. And we've realized that morbid obesity, especially the BMI over 35, is increasing and increasing every year in this country. Every decade we look at it, every year we look at it, it's going up and up and up. So, and that's, you know, what an epidemic is. It's kind of an outbreak over time that needs to be addressed, and it's having a very negative impact on our country, on you know, on our society as a whole.
Okay, so how do we get here? Is it all about the plate, what we're eating?
Yes, that's a big part of it. Our food choices, portion control, our levels of activity throughout the day, all affect, you know, our obesity rate and how bad obesity has become in the country. You know, we do make a lot of bad food choices. It starts, unfortunately, we see it more and more in childhood. Those habits that you develop as a child, you kind of maintain into adulthood. And so we see that, you know, if we can, you know, maybe get a rein on or a handle on some of this at a younger age, maybe we could get more of a handle on it as people age. They wouldn't become morbidly obese. But at this time in the country, we've got, say, you know, in round numbers, 300 million people in the United States, and about 100 million qualify for weight loss surgery. There's about a third of the population now has a BMI 30 or greater or on 35.
Okay, you mentioned young people. We're talking Gen X, Y, and Z.
Yeah.
So what do the Gen X, Y, and Z need to do right now to combat being obese in the future? Because now it seems like a trend. You know, being overweight is just a cool thing, or maybe they don't really know the health risks. So what does their future look like right now if they're overweight and obese, if they don't change that, the dynamics of where it's leading?
Yeah, obesity, again, every time we look at it or track it, is getting worse and worse, starting at a younger age. Kind of how we've evolved, I think, over time, we've become a very kind of obesogenic society where what we're doing is promoting weight gain. Eating several small meals a day. Intermittent fasting is a good thing, not a bad thing. We're always very concerned about when is our next meal.
Yes.
Well, I hate to say, but maybe you should skip one of those. More physical activity, better food choices, portion control. You know, these are all things that you can start early to hopefully combat obesity at a later age. But that's really not being done, because if it was, we would start to see a decline in obesity, but in fact it's going the other way.
Wow.
To talk about obesity in the numerical terms, it's important that people understand what their BMI is. The BMI, body mass index, is a calculation between height and weight. It's, if you go on the internet, if you go to my website, you can just Google BMI and you can put your height and weight into a calculator and it'll tell you what your BMI is. Overweight starts around 25 to 30. Technically speaking, that's what overweight means when your BMI is in that range. Obesity starts at 30. 35 is class 2 obesity or morbid obesity. 35 and greater, you need surgery. There's nobody really at this point that's disagreeing or saying that that's not a time to approach and start thinking about a surgical intervention. And that's roughly about 100 pounds overweight. Once you've reached 100 pounds overweight, the chances of you losing that weight through diet and exercise is not nothing, but it's close enough to nothing that you really should consider having surgery. And that's what I see day in and out at my practice is people have been, they've had the ability to lose weight. They've all lost weight over time, but all of them gain it back. Surgery can help you lose the weight and keep it off for the rest of your life. That's the difference when somebody really makes that commitment to get a gastric bypass or a gastric sleeve, that they're committing for the rest of their life to keep that weight off. So.
Okay, so does most people, they get the weight loss surgery, I know quite a few that have been.
You've had a lot on your show.
Yes, very
several.
successful, lost a lot of weight, look really good, but what I love about is the first thing they say is how much better they feel as far as their health. Of course, they're happy, they look really great too, and they can fit, as you say, in a seat on an airplane or
Sure.
a stadium. But what about the people that don't do well with it as far as keeping the weight down? Is that because they went back to eating the way they were eating prior to losing the weight?
Like the term recidivism, when you go back to the old habits. To get the surgery, to qualify for the surgery, you have to meet all the criteria, but it takes a good, 3 to 6 months to have the surgery, and throughout that time, we screen the patients and teach the patients how their lifestyles are going to have to change as far as food choices and portion control, and take your vitamins, a little bit of exercise. Not difficult things, but things they need to do lifelong to be successful.
Yes.
And we tell them that the surgery is only a tool. If you give somebody a shovel, the hole's not going to dig itself. You got to take that shovel and you got to dig it. But I'm going to give you the best shovel you've ever had to lose weight. And if you use that tool, you will maintain your weight loss and do fine. Occasionally, a patient will get off track. They'll resort back to that, snacking, empty calories, not exercising, and they will regain some weight. But we can catch that early and get them back on track. Once you have the surgery, it's a lifelong follow-up. We're going to see you in the office for the rest of your life every year to track your weight loss, make sure it's staying off, check your vitamin levels, make sure your nutrition's good, and monitor you, forever. It's a commitment that I make to the patient, but they also make it to me that they're going to make the changes to be successful forever. This isn't just a temporary fix. It's not a vanity situation. Yeah, you're going to look better, you're going to feel better, but ultimately my goal is to correct all the comorbidities and medical problems that go along with the obesity. So the patients that regain weight, we really, honestly, we don't have that many, because we really, I think, do a good job on the front end of teaching the patient about what the changes they're going to have to make and how they're going to, have to maintain, their goals and stay at the weight they want to stay. And if they have any regain, we get them back on track. We do a really good job with that.
Okay, well, we're going to take a break, and when we come back, we want to talk about the health risks.
Oh.
We're going through the body systems.
Yes.
So people would know losing weight is not just about being vanity. It is about your health and wellness.
Yes.
Okay. We'll be right back to talk more with Dr. Robert Wegner about the future with young people dealing with high BMI, as we discussed a little earlier. And we need to talk about the health risks. We'll be right back.
It's very fun to be in band, trust me. It's so much fun.
When I was an 8th grader and I saw them march, and I was like, wow, I need to be a part of this.
Our main performing group is the varsity band. That encompasses our marching band and our varsity concert band. We also have the jazz ensemble.
It's unique, so we're really lucky to have that.
I'm very methodical about teaching. I try to stay up to date because I want my students to have the best information that I can pass along to them.
He's excellent. He commands a sort of drive that we didn't exactly have.
I lead the class, but I also believe in the students self-assessing their work.
The leadership is led by the students. We lead most of the practices. It's basically just student-led.
And I think that's important for them to take that kind of ownership.
If you want to be a musician, you gain extremely important music skills, music techniques.
1, 2, 3.
There's so many opportunities for fellowship, and band is a family. And you develop that small community where you support each other, not only musically, but in many ways.
Really, without the band, the football games would be lame. Without the band, you wouldn't really have the pep rallies. The band is like a good foundation for the school spirit. If you want to join band, just do it.
I think band was the best part of my high school career.
For more information about the Kappa program, visit ghskappa.com or call 755-7775. You're watching the award-winning GHS-TV, a nationally recognized student television station.
Welcome back to Medical Talk. I'm your host, Betty LaMarr. On today's show, we're talking about the health risks associated with overweight and obesity with my very special guest, Dr. Robert Wegner, bariatric surgeon. Dr. Wegner, now, we just talked a little bit about what bariatric surgery is all about, but I would like to know about the body systems. How does overweight and obesity affect the body systems?
So the human body is not really designed to carry around an extra 100 to 200 pounds. So when you put that kind of stress and pressure on the body, every organ system is negatively affected, from head to toe, from skin to bone. Everything from psychiatric, cardiovascular, pulmonary, GI tract, musculoskeletal, skin. Every system has a negative impact from obesity. So if you can cure the obesity, get the 100 pounds off or more, most patients are at least 100 pounds overweight, all those medical issues, not guaranteed 100%, but the majority of them will be decreased if not eliminated, which along with that is the medication list. So, patients come into the office and they've got a medication list that's, it's a full page. I mean, they're on medication for, migraines, asthma, acid reflux, high cholesterol, high blood pressure, type 2 diabetes, joint pain, they're sleep apnea. The women can't get pregnant. They're all on, some kind of weight loss drug. The list it's enormous. And so if they have the surgery, lose the weight, make the changes, all of a sudden their blood pressure is normal. They don't need their CPAP machine for sleep apnea. Their type 2 diabetes, is cured. They don't need the metformin and the insulin and the things to control their blood sugar. Their acid reflux gets better. They don't have asthma. They don't have migraines. Their joints don't hurt. If you go on the website and listen to the patient testimonials, they all look fantastic, but it's how they feel.
Exactly.
Just getting out of bed in the morning, if you're morbidly obese, is a struggle. I mean, you just don't feel good. You just hurt. You're sore. You don't want to go out of the house. A lot of patients, they don't do anything social because they don't have any energy.
Right.
They can't play with the grandkids. They can't take the dog for a walk. They can't go shopping. They don't enjoy the things that we enjoy.
And the stigma too. You feel like people are like staring at you and judging you because people do unfortunately look at people overweight as though they're lazy.
Yeah.
You're just big because you're lazy and you don't want to do what you need to do.
Yeah, it's very true, and it's very unfair, and it's very, very sad when a patient feels trapped in their own body. They feel like, oh my God, I have so much to offer, or I want to do so many things, but they feel trapped in this 100-pound overweight body. If they could just get that weight off, they feel like they blossom and they come out of their own shell. Patients will talk about like just being out in the general public, going into a store, for instance, to go shopping. When they were morbidly obese, the people working there wouldn't even acknowledge them, wouldn't even look at them, wouldn't talk to them, come up and say, hey, can we help you? All of a sudden, a year or two later, They lose 100, 200 pounds, and all of a sudden there's a person standing there that they show interest in, and can we help you, and this and that, how's your day? And all they did was lose weight. They're the same person that they were 100, 200 pounds ago, but because they were morbidly obese, yes, society is cruel and it's not fair. And if I can help people get out of that and get their life back, it's the most rewarding thing. And patients talk about it all the time routinely. Things that you and I take for granted, they really struggle with on a day-to-day basis. You know, and once they lose that weight, their whole life changes. It's unbelievable.
Yeah. I remember, you know, interviewing, well, 2 or 3 of your patients at least. And like I say, they all say the same thing. I feel so much better now. And one in particular mentioned to me that when she made a solid decision to have the surgery was because one morning, the day before, she was at work and they did like a book fair. And she was on her feet all day. And she was like 405 pounds. She said the next morning she could not get up out of the bed. Her body hurt so bad that she knew then. So how many people are basically, I guess you would say, driven to the procedure because maybe one day they wake up and they cannot function anymore. Their knees just cannot take the weight anymore.
Yeah, there's most patients, not all, but most do have that light bulb moment.
Okay.
Where I'll ask them, okay, so what finally made you either come to a seminar or make the phone call for an appointment, or what finally drove you to, you know, really commit to doing, you know, the surgical procedure? And they all have some, you know, kind of light bulb moment where it just clicked to them where if I don't make a change, I'm not going to be here in 5 or 10 years. Or the life I'm leading right now is so unsatisfying and I'm just not happy at all that I'm willing to make that change, that drastic change. And so, you know, a lot of patients, they're just uneducated about, first of all, how safe the surgery really is. And I think we're going to talk about that a little bit later. But this is one of the safest elective surgical procedures that you can do statistically. So again, patients have a fear that it's unsafe, or the other misconception is that it's cheating. Like, oh, if I get the surgery, I'm taking the easy way out. And I hear that a lot too. And it couldn't be further from the truth. Again, the surgery that I do, whether it's the sleeve or the bypass, is only a tool. You still have to participate actively every day for the rest of your life for this to be effective. It's not the easy way out, but it's the best way to lose 100 to 200 pounds. It's also the safest way. A lot of patients have tried these diets, you know, these fad diets where, you know, they'll get a book or see something on TV, or a celebrity diet, which we're just inundated with this stuff all the time through social media. It works temporarily. I mean, anybody can lose 50 pounds for 6 months. But the question is, are you going to make those changes for the next 20, 30, or 40 years of your life? Chances are no. You're not going to be able to maintain that starvation diet or that ketosis diet that everybody thinks is so fantastic. You can't stay in ketosis for the next 20 years.
A good example, and we'll come back after this break, the balloon.
Yes, the balloon.
Okay. We'll be right back shortly after with Dr. Wegner, and we're going to talk about the weight loss procedures. We've learned what bariatric surgery is. Now we're going to go into the procedures. We'll be right back.
Art is really an expression of the self. If you look at a piece of art, you can see the artist within it.
All just really depends on what I feel like doing at the time. I generally have different ideas every day.
I really get excited when my students come up to me with unique ideas that I've not heard of.
You can't let everybody tell you who you are or what your art is or how to be what you want to be.
I really let the students go according to how they're progressing, and I try to give them as much as they're able to handle.
Well, I like drawing a lot, and I like painting, and I like being able to improve my skill and show people my art.
I try to get them to think creatively. I think that's one of the few things that we as teachers really need to try to push with our students.
I can't sing. I can't act either, but I can do art, so that's why I chose art.
For more information about the Kappa program, visit ghskappa.com or call 755-7775. You're watching the award-winning GHS-TV, a nationally recognized student television station.
We're back with Dr. Robert Wegner, bariatric surgeon, and we're talking about the various surgical procedures and the benefit of weight loss surgery. Welcome back, Dr. Wegner. Thank you so much for being here today, giving us the tools that we need to make healthier lifestyle choices. So now let's go into the surgeries. I know we have the Cadillac, but I want you to just break them down for me, and I'm going to sit back and learn something.
All right. So essentially, I do the two most, I would say, not popular, but the most beneficial procedures that are out there, which is the Roux-en-Y gastric bypass, which has been around for decades, and the gastric sleeve, which has been around for, say, 10, 15 years, becoming more popular and popular every year. I don't do the gastric band. I learned I know how to do it, I was trained on it, but the effectiveness of the band has really fallen off. So I strictly do gastric bypass and gastric sleeve as the two primary procedures that I perform. I've done around 4,000 in the last, say, 10 years since I've been here in the Memphis area. The gastric bypass has been around, like I said, for decades. There really isn't anything we don't know about the procedure. It's statistically extremely safe, has a very low risk profile. It wasn't always like that. Bariatric surgery has evolved, like any other surgical procedure, from where you start trying different things and different techniques. The instrumentation is much different now. Visualization, the stapling devices, the suturing devices that we use are all so high tech and state of the art that it has evolved into one of the safest elective procedures that we can do. But the gastric bypass involves basically, say your stomach is shaped like a football or just a big solid football. We're going to turn it into something about the size of a tennis ball. Oh. And then we're going to reroute the intestine and attach the intestine to that smaller stomach pouch that I carve off the big stomach. Nothing is removed from your body. Nothing is put in your body. Everything is still there. What I hear from patients and what the stigma is out there is, I'm going to use the word that I hear all the time, everybody just about gets scared of, is rerouting.
Okay.
I am, in a gastric bypass, going to reroute your intestine. I'm going to reroute where your food goes when you eat it. The new route that I create is what creates all of the great hormonal changes that cure obesity. They cure all those hormonal problems that obese people have. And I tell people, if you don't want me to reroute your intestine and make your stomach smaller, then keep the route you have. This is where it's gotten you. It's gotten you to 200 pounds overweight and all these medical problems. If I reroute things, we're going to see a drastic change in your metabolism and your hormones that control obesity, and you're probably going to lose 100 to 200 pounds. It's a fantastic procedure. It's very safe, and I highly recommend it. I've done thousands of them. That's the Roux-en-Y gastric bypass.
Okay.
The second procedure I perform is the gastric sleeve. It's been around and been approved by insurance for, say the past 5 or so years. The gastric sleeve does not involve any alteration to the intestine. Basically, if you start with that large stomach again, kind of like the football, we're going to turn it into a banana.
How?
So I'm going to remove about 3/4 of the stomach. I'm going to staple the stomach off, and the section that comes off to the side is actually removed from your body. So you're left with a very thin sleeve, like a gastric sleeve is why they call it that, of gastric tissue. So nothing is put in, but something does come out. And what comes out is about 3/4 of your stomach. So you're left with a thin gastric sleeve. But I don't make any alteration to the small intestine.
Okay.
So it's a different procedure than the gastric bypass, still very effective. If I had to compare the two, statistically, there may be a slight advantage to the gastric bypass, especially with type 2 diabetics and with hormonal issues like PCOS and infertility. That procedure seems to be particularly effective in controlling hormonal issues, but they're both very good for weight loss. Patients will lose anywhere between 50 to 70% of their excess weight within a year, say to a year and a half. Very effective, and they're permanent, they're lifelong, they're not reversible. And then I'll have a patient ask, well, what if I want to have it reversed? I said, honestly, in doing this for 10 years, I've never had a patient say, hey, I'd really like to gain back my 100 pounds. Can you please reverse my gastric bypass? Just put that out of your mind. This isn't a reversible thing. The changes that you make, the changes that I make to do the procedure are going to be permanent, lifelong, but also so are the results. So you want to keep that weight off, and you want those changes to be forever.
So why would a person want to reverse it? What would be the psychology for wanting to reverse it?
I don't know. I've had patients, the changes, when you go through, when you're a morbidly obese person and you lose that much weight, you feel like a totally different person.
Okay.
I don't know if, and this is very rare, but I have had patients say, you know, I don't feel like myself anymore. When I look in the mirror, I don't even see myself. I see someone totally different. And so it's kind of shocking to them when they become a different person after this procedure. So, you know, but patients will ask on the front end, you know, is it reversible? I think because they just want to know if it can be done. But I've never done it, and I've never had a patient ask me to do it.
It's like a just in case.
Yeah,
I
and
changed
the same
my
way
mind.
when they ask, well, the number one question is, you know, what about loose skin? That's the number one question I get at a seminar, or if I go out and talk to patients, you know, in a general setting. You know, if I say, do you have any questions? The first hand up is usually somebody asking about loose skin. What am I going to do with the loose skin? I'm going to say, you're going to have some loose skin.
Yes.
You know, your options are to not have the surgery and keep your skin nice and tight and be 100 pounds overweight. Or you can lose 100 pounds and have some loose skin, get rid of your diabetes, your high blood pressure, your acid reflux, your sleep apnea, and, you know, wear a little, you know, latex or a spandex or Spanx or something.
Yes.
You know, if it really bothers you that much, you can have this loose skin removed.
Yes.
But every patient I've ever operated on has some loose skin. It might be the first question they ask before surgery, but it's really, you know, a year, 2, 3, 4 years down the road, it's the last thing on their mind.
Well, I've seen some bariatric beauties, and
You've seen them.
If the skin is there, it's like you don't.
Yeah, they look fantastic.
Yeah, it's like
you
they
see
look
them in
so
pictures.
good. It's almost hard to believe.
You don't even know they had surgery. You see them in the videos, and you see them out. You know, patients come up to me. I'll be out in a public setting, you know, at an event, or even in, you know, the shopping center or a mall or whatever, the gas station or wherever I'm at, and someone will come up and say, hey, Dr. Wegner, you know, how you doing? I'm like, oh, you know, who are you? Oh, you did my surgery 3 or 4 years ago, and
you don't
and I don't recognize them.
yourself.
No, they look totally different. They look like anything like they did, you know, 3 or 4 years ago. First of all, they look like, you know, you and I. They're normal BMI. They feel great, and you don't know if they have loose skin or not. I mean, that's all a perception that they're afraid of before surgery, but actually they feel great.
Now, before we go off the air, first of all, just thank you so much, again, for taking the time out of your busy day, because somebody probably is waiting on you at the clinic now so they can get this fantastic procedure done. But before we leave, give us you mentioned your seminars and your websites. Give our viewers all that information if they want to follow up with you.
So I tell patients that if you're thinking about it, chances are you know you need it. So you've got to make that step to make it happen. I'm not going to come to you. You got to come to me. You got to either go to my website or do the seminar in person or do the seminar on the website, and we have to get the ball rolling. But if you can make the initial contact with me at the office or with me at the seminar, you know, we can go from there. You know, my Memphis Weight Loss Surgery.com is my website. You can Google my name, you know, Dr. Robert Wegner, surgeon, Memphis comes up, and you can find all these links to get to me so that you and I can sit down, you know, being the patient, you and I, the patient, can sit down and talk about intelligently surgical weight loss, what your goals are, what your struggles have been, and how we can get you where you want to be. But the patient and the individual has to make that first step to seek me out. And once that's made, then we can make a connection and go forward. And I really do want to help as many people as I can. But as many surgeries as I've done, I look around, you know, throughout this area, throughout, you know, the community, and there's still so many people that I know I could help with this surgery.
Okay. Well, thank you again, Dr.
Thanks for having me.
Robert Wegner.
Thanks, Betty.
While obesity is a growing problem, it is not impossible to overcome. For more information on programming, please check us out on the web at GHS-TV.org, where we're streaming live 24 hours a day. You can also check us out on Facebook and Twitter. I'm Betty LaMarr from all of us at GHS-TV. Thank you for watching Medical Talk, and I hope to see you again soon.